know, we are facing one of the biggest cuts in social assistance in the history of the government.
You either sit home and die hunger, or you go fight and show people that I'm dying, I'm hungry.
We, S-T-R-U, we struggle, E-V-E-R, every day.
What's gonna happen on July 31st is that every single person getting the special diet, every single person that requires extra money to be able to eat a healthy, halfway decent diet on social assistance is at risk of losing it.
And so for the $5 left for food, I realized that these people aren't gonna make it.
Yeah,
I'm on ODSP. It's barely enough to live on. Without the special diet, I'll only get $800 per month. It's terrible. Most people can't even pay their rent. It's a choice between eating and paying rent. One of my employees who was a member of OCAP told me about the special diet. If she hadn't told me, I would have never heard of it. It makes a big difference. I can buy healthy food and pay my bills.
I have a daughter who is diabetic, who is 17 years old. I have a son who is turning 20 now, and myself. It's me having a daughter who's diabetic, who doesn't, if you get the money that we get, is what I get is $900 without the special diet. When I pay the rent, about $400, and I pay the hydro for $150, whatever is remaining is actually not even enough for 15 days of to buy food or anything. 4 years ago, I had through Ontario Coalitions Against Poverty. They're the ones who introduced in Etobicoke, letting people know about the special diet, because most of the Somalis here didn't know anything about special diet. So we came to know about it, and then we started filling up the forms with people who have problems.
I've been in the hospital sector for going on 11 years. Several years before that, I was actually a social assistance recipient. I was on and off welfare about 3 times, and I actually, the last time I was on welfare, I was a single mom at the time, and I needed some help, and I was really thankful that I could go back to my job at the hospital, because I couldn't imagine, when I got a check from social assistance, I couldn't imagine how I could possibly ever survive on such a tiny amount of money and raise 2 kids. So back in '96, I had finished college. I had gone back to school to get my grade 12, and I did well, and I wanted to further my education, and I graduated from college, and partway through my program, my CARES became in power and started cutting everything.
One of the major relationship between health and other factors is income. Income is much more a major predictor than high cholesterol, than smoking or any other items. You know, if you think of it, for every 3 rich babies that lives up to 1 year of age, only 2 poor people's baby will live to 1 year of age. That's sad. For every 1 person who is rich and died of suicide, 3 poor people would have died from suicide. For every rich person with diabetes, there'll be 3 people who are poor with diabetes.
well, I-R-E-A.
I reapplied for the new supplement, but I'm not sure if I actually got it, because I haven't gotten any kind of notice. I'm really hoping I do, because I don't know what I'm going to do without it. I really had to look carefully at the form because my condition, cerebral palsy, wasn't actually on it. So I had to say that I need soft and liquid food, which is true. I don't know why cerebral palsy and muscular dystrophy aren't on the list at all. There are other things that should also be on the list, of course.
So from the time that the money is done and we have nothing in the house to buy food or anything, maybe we go to food banks, and what do you get there? Just a can of beans or a bread, which is white and she's not supposed to eat. She eats a lot of carbohydrates and her sugar level goes high.
We know that rates of chronic disease, diabetes, arthritis, lung disease are higher amongst people who are living in poverty. Mental health conditions are much higher as well. For example, suicide is significantly higher among people who are on welfare. And then other mental health issues like depression and anxiety, very significant.
Part of it in the hospital where I'm at, we're a complex continuing care facility, and a lot of those people are there because they have multiple disorders, and a lot of them are poor, and they don't eat well, they don't have the means to look after themselves, they don't have benefits, they don't have jobs, and so their health just deteriorates to the point that they end up in a place like St. Peter's Hospital where they need constant nursing care.
Another huge impact is looking at children who are living in poverty and the long-term health effects. So even if their socioeconomic status increases as adults, they still are left with increased risk of chronic illness.
Sicknesses that kids are going to develop is going to hunt the government down, because these kids are going to spend the rest of their lives in hospitals. They might get kidney infection, they might become blind, they might be, sick of any kind, have allergies, have lung problem, have this. We're going to spend more money on people who have been refused money to eat food in the healthcare center. We're going to go to hospitals, we're going to spend more money on that. Because I know if my daughter doesn't get the food that she needs, in the coming years, she might end up in dialysis.
We start to do things. It is not important to just keep on talking. We have to help people by putting food on the table. Food on the table means money in the pockets. That's simple. It is not something where you have to do some fancy calculations and statistics to show that.
Believe me, people in Etobicoke have realized that. Anywhere they hear there is a rally about poverty, they are ready to go. Just to tell people, to let people know what their situations are.
We need to be aware of the issues first and foremost, and I think that awareness is increasing, but obviously there's many people for whom it's not a concern. So I think that the more we can increase that amongst healthcare providers is something that I feel is really important. Awareness, but then more than that, not just the awareness, is the real commitment to moving forward and to fighting against this, to not give up, but to really know that we can do something.
For us as unionized people in the labor movement, we need to give them our voice, and in turn I'm sure that they will give us their support, because when we raise up, they can raise up as well, and that's really what I understand to be the grassroots mandate of the labor movement.
I've gone
on demos and read speeches, and I'll continue to do this until the government actually respects us. I'm very passionate about this cause. We need to be heard, not just by government, but by society, so that they understand what we're fighting for. We're not just whiners trying to get $5 more. We need a living wage so that we can live and thrive. People on ODSP and OW need special diet money. We struggle every day to make ends meet, and it makes things even worse when people look down their noses at us.